Welcome to Quality Insight's Quick Start QAPI resources that are designed to help you get any performance improvement project up and running quickly. Julie Kueker, the Reducing Healthcare Acquired Conditions in Nursing Homes Network Task Lead, will review a topic-specific Quick Start guide. Today's topic that we're going to take a look at is antipsychotic reduction. So at this time, I'd like to turn the session over to Julie.
Thank you, Krista. And in this session, we hope to provide you with those tools and resources to get you guys quickly and easily started for this topic's performance improvement project of antipsychotic reduction. For QAPI, you will want to have at least 3 elements in this performance improvement project. And for antipsychotic reduction, it's an important one for you guys because it does have that national focus. It's a focus in the National Partnership to Improve Dementia Care. It was also in the final rule mentioned quite extensively on the mechanics of how you will want to implement this project's improvement. It defined the use of psychotropic drugs. It also explained to you how their gradual dose reductions and behavioral interventions. So this performance improvement project is very timely for you. Now, typically, most projects do contain 3 elements, and they are a root cause analysis, setting a stretch yet attainable goal, and an action plan to improve with that plan for sustainability. And we're going to go through each one step by step for you during this session. The first step out of the gate is to make sure that you have those good folks, those good performance improvement team members included. You will want to, I'm sure, have in this team part of your frontline staff. Don't forget the resident and the family members. They have an important voice in all of your performance improvement work. The pharmacist, key clinical staff, those folks with the skill to make this project really successful, and leadership. You'll want to gather your baseline data as you start in this initial project to make sure you have that good information because, as you know, you have to know where you're going, to know where to set your goals and how to improve. So at the beginning of this project, make sure you have your current CASPER report. Get your MDS coordinator to run this for you. You'll also want that resident roster mix report. Your MDS coder will also run this for you. It will define and tell you which one of your residents are in the numerator for each one of your public reported quality measures. You might want your pharmacy reports to help you in that gradual dose reduction piece of the improvement. And in the end, be aware you may need to do some chart review to get to that good information for improvement. Now, for all of this and for most performance improvement projects, you will want to meet monthly more than likely, so you will be able to reach your goal. Now, typically we stated there are 3 components and parts to most performance improvement projects. Let's go through that first one of it. It's a root cause analysis. This is where you keep asking why until you have identified that real cause, that bottom line to the problem. This is an essential piece to any performance improvement project because it reviews all the details to the problem. And make sure to get all your staff members involved in this input. It's an empowering technique as well. You're giving voice to folks who may not have had their voice listened to before. And make sure when you do any root cause analysis that you focus on the process, the way that you do business, your policies, your procedures, not people. The real improvement needs to come from your process. So here is an example of one tool that your Quality Insights can provide to you, and that's the 5 Whys tool. It's pretty simple and straightforward and just as easy to use as you would think. You keep asking why until you finally get to the bottom of the real problem, and you can utilize our tool to document that root cause analysis. Another one that we have that we can provide to you is called the fishbone. looks a little more complicated, but it's actually very easy to use. Again, the whole purpose of it is to focus on the why. Why is our rate high? So my recommendation, if you like the fishbone, is in your very first team meeting, whoever is the champion of this project, and it does not have to be leadership, but whoever you identify as passionate about this improvement, that champion will go around the room and ask everyone for their input. Why do you think our rate is high? What is causing that? You will capture everyone's ideas, jot it down on a piece of paper. When you go back to your office, you'll put all of those items somewhere in this fishbone. And remember, there's no wrong answers or right answers. They're just your answers. And then you'll bring back this tool to your team. And from there, you will prioritize those areas that you want to start improvement on first. So we've completed the first element of the root cause analysis. Now we need to do that second element of goal setting. It's important because you need to quantify a measurable improvement result without guessing if you've gotten any better. It should be a stretch. You want to work for it, yet it still should be attainable. It should be clearly stated so all team members are aware of the description of what you intend to accomplish. Goals for your performance improvement project are best and recommended to follow that SMART formula: specific, measurable, attainable, relevant, and time-bound. But the good part is the tool that is provided to you by QAPI at a glance, by CMS. You will see the website here at the bottom. This blank tool contains all of the elements of that SMART formula. So if you utilize this goal-setting worksheet, it is built right in, and you can fill this out and set your goals for your project and be on your way. So let's talk a minute about when you fill this goal out, what will it look like? Now remember, at the end of this program, you will get my email address. Email me, and I will send you these blank documents as well as these example documents for yourself as you're moving through your performance improvement project. Now, with all examples, they may or may not meet survey, but here we have followed directly along that goal-setting worksheet. We described the business problem to be solved, which in our example, we want to improve 25% using that multidisciplinary approach. Who will be involved is our team members who have that stake in it, who have that great knowledge. They're multidisciplinary. That is important in any QAPI project. What measurement do we want to use? For this project for antipsychotics, most folks do use that quality measure coming straight from Casper. It responds pretty well to improvements pretty quickly. It's just fine. You may also want to use some internal data tracking as well. You'll list out where your current data is and what you want to decrease that number to. And also making sure in this document at the last part is the target date. You want to give yourself when you want this improvement to occur, because if we don't set an end date, many times teams flounder and we never reach our goal because other priorities seem to set things aside. Give yourself a time of when you want this improvement to occur. Once we've set our goals, then we are going to want to follow that action plan to improvement. We're going to want to plan and do and study and act so we know exactly how improvement occurred, do the best possible methodology to get there, and our best shot of sustainability. So to plan, let's dive a little bit into that antipsychotic quality measure. Most folks do use the Casper report, and this is that quality measure, your public reported quality measure on antipsychotics. It's pretty straightforward. However, it does have 3 exclusions, and 3 only. But if you have a resident who is diagnosed with schizophrenia, Tourette's, or Huntington's, and they are on an antipsychotic, they are not in the numerator. So everyone else who is on an antipsychotic, they will be in your numerator. Remember to run your roster mix, and you will be able to figure out who the NDS, these quality measures, is identifying as part of your numerator for this quality measure. Now let's go dive a little bit into the tools that you're going to want to use to improve. We have a great one that you'll want to use at the beginning of your project, and we call it the trigger tool. What it helps you to do is to prioritize residents for antipsychotic gradual dose reductions with residents and patients with dementia and a diagnosis of psychosis. What this tool does is it helps you identify who is on the lowest dose. Are they on a PRN medication? All of these can lay into and lay the foundation of who might be the best resident to start with first. So make sure as you're planning to utilize this tool for improvement and get that blank one from us. The next tool you'll want to use from us is a step-by-step guide. These are questions that you're going to ask during the course of your team meeting. They will force you to dig a little deeper into these residents. Why was this antipsychotic started on the first place? How long have they been on it? How long have residents not had behaviors who are on antipsychotics? Are they on PRN medication? Were they admitted from a hospital with it and haven't been on an antipsychotic very long? All of these are great questions to be able to help you identify those folks where you might have success with gradual step reduction. Our next tool that you'll want to take advantage of is screening admissions tool. And what this does is it helps you and assists you of identifying those residents who are admitted to help you challenge that antipsychotic use at the door. Perhaps a resident just got started with an antipsychotic during a hospital stay, maybe post-surgery. They exhibited sundowning symptoms. The hospital was unprepared for how to deal with difficult behaviors, but you're set up for that. So you may very well find that this resident no longer has the need for an antipsychotic. Working with your physician and your medical director, determining with this resident to see if antipsychotics should be continued or perhaps stopped in that screening admission process. This is a tool that's meant to be used between yourself, your admission coordinator, your medical director, and all determining appropriateness and the use of those antipsychotics. And don't forget, for any project, you will want to document those action steps over time. We have this blank document for you. And what it does, it builds in that Plan, Do, Study, Act. It lists out all of the steps that it's going to take for improvement. Now, in the example I have provided to you, you will see measure number 1 is straight your Casper quality measure. Most folks do use that. But there's a couple other quality measures that have been identified that are self-tracking, self-developed, that you will want to do as an internal tracking measure. Maybe it's those residents with a pharmacy consultant review. Maybe it's those percent of CNAs completing the hand-in-hand CMS training module, because you want to make sure they have the tools that they need to handle difficult behaviors rather than the historical methodology of always asking that nurse for an antipsychotic, pushing the panic button. Instead, we're going to try something non-pharmacological. Here are some of your example steps that your team might take, including identifying those risks, those residents who have on dementia, should they be prioritized for reduction? Who has a PRN order? Who is on the lowest dose? You might have somebody on your staff identify your current practices and compare that to best practices and see what the differences might be. So listing out your action steps is a great way for any performance improvement project, for anybody following you along behind you, to see what you did on your path for improvement. And when you're doing your quality improvement project, don't forget to track your progress over time. In the example I have before you, it's a nice decreasing rate from our example, which is identified as Sunshine Nursing Home versus the national average. However, don't forget you can go to My Quality Insights webpage, download your report, your composite report, and there you will find where we have tracked you over time, and you just download it and hit print, and you'll have this nice, pretty graph for yourself as well. As you are working in this performance improvement project with your team, don't forget to ask yourselves these questions as you're going through the project. Is your staff ready for that non-pharmacological interventions for those difficult behaviors? Training, education may need to ensue. Is your staff educated to challenge antipsychotics on admission, at the door, and to review for medical necessity? Is your medical director and/or nurse practitioner able to challenge an antipsychotic that was prescribed by a psychiatrist in the hospital? How are you using psychotropic drugs in your facility? Is it PRN? Is it off-label? Do you have criteria in place to review all psychotropic medications for medical necessity? And do you have that good gradual dose reduction mechanism in place working with your pharmacist as a partner? Do you review your quality measures at least monthly for improvement? Download that CASPER report, that resident roster mix? And are nursing and MDS coders aware of how that antipsychotic quality measure works? So in conclusion for this quick guide, make sure you're using the following principles. Make sure everything that you do follows that QAPI process. Educate all the staff, not just the team members, but all the staff on the improvement process. Assess your system, not people. Assess your policies, your procedures, the way you daily go about your business. Perform a root cause analysis. Set that stretch goal for the project. Make sure that your improvement model follows that plan, do, study, act. Monitor process change to secure improvement, data track over time. Learn from your challenges and celebrate those successes. And don't forget to contact myself or your quality improvement project coordinator for assistance in these performance improvement projects. So in conclusion, once you have reached your target goals, it's important to continue to monitor and educate to sustain your gains in this project. Celebrate successes to reward the hard work of improvement in your nursing home. The QAPI at a Glance document does have a sustainability decision guide for you to use, and you can print that out and also put that in your QAPI binder. We've included resources for you so that you can compare best practices to your current policy. You'll find listed that National Partnership to Improve Dementia Care, as I mentioned in an earlier slide. You'll find great tools at that Iowa Geriatric Education Center. And there is your link for the CMS hand-in-hand toolkit for that CNA education on difficult behaviors. I hope that you find this quick start guide to your performance improvement project helpful. Should you have any questions, want those blank documents, or want the example documents, please email me at the address on your screen, and we will help you get started quickly. And thank you very much for your commitment to the improvement of the lives of your residents.